In this video, we're going to be talking about diagnostic tests for H. pylori infections. We're going to compare a few invasive and non-invasive options that a physician has right now. Before we talk about the test, let's talk about the bacteria a little bit. So H. pylori is a gram-negative microaerobic human pathogen, for which humans are the primary reservoirs. H. pylori infection is strongly related with many gastroduodenal diseases like peptic ulcer diseases, atrophic gastritis, chronic active gastritis, and non-cardiac gastric cancers. A fun fact, H. pylori is also classified as a group 1 human carcinogen by the World Health Organization in 1994, and it is the only bacteria so far that have made that list. The reason for this is that H. pylori infection affects more than half of the adult population worldwide. If the infection is asymptomatic, then hosts are colonized for life unless treated. Even though there is no specific transmission route for this bacteria, a few common ones are gastro-oral, fecal-oral, or oral-oral, basically saying that the common transmission route is through vomit, saliva, or stool of an infected person. H. pylori significantly affects our GI tract, accounting for 80% of peptic ulcer diseases, and the estimated lifetime risk for peptic ulcer disease in H. pylori infected patient is about 15%. Gastric cancer is also the third leading cause of cancer-related death worldwide, and the H. pylori infection is responsible for 75% of all non-cardiac gastric cancer cases. So let's talk about the diagnostic tests available. The options available are rapid urease test, histology, culture, polymerase chain reaction test, urea breath test, stool antigen test, and serology testing. Each of these tests are either invasive or non-invasive, and they have their own set of advantages and disadvantages. When narrowed it down to 4 tests, comparing them on the basis of cost, availability, need to stop any medicine prior to testing, and sensitivity and specificity of the test for H. pylori. So the first option we have is a blood test. It is going to check for antibodies to H. pylori. The average cost is about $100 to $300. The testing is a convenient procedure where somebody draws your blood and then they test it in the lab. The advantages of this test are that it is low cost, is widely available. There's no need to stop any antibiotics or protein pump inhibitors prior to ordering this test. The disadvantages, however, are that it cannot be used to measure the response of the treatment you are receiving, and there are increasing number of insurance providers that are not approving the reimbursements for such serological tests. Second option is urea breath test. It costs about $95 to $150. This test measures the amount of carbon dioxide in your breath, and it utilizes the ability of H. pylori to catalyze the hydrolysis of urea to ammonia, and carbon dioxide is a byproduct in this reaction. Therefore, the test measures the amount of carbon dioxide present in your breath. The way they do this is they ask you to blow air in a bag to measure the baseline amount of carbon dioxide present in your breath, and then you are asked to swallow a urea pill or a drink that has urea in it, and then after 15 minutes you blow again in a bag and they compare the amount of carbon dioxide with the baseline levels that they measured before. This test has many advantages, like it offers evidence for active infection, can be used as a first diagnostic test, and also to confirm how the patient is responding to the treatment. It is also recommended by American Gastroenterology Association and American College of Gastroenterologists. The only disadvantage it has is the physician needs to stop antibiotics and protein pump inhibitors for at least 2 weeks prior to ordering this test. The antibiotics and PPIs must be stopped before, because the test relies on the enzymatic properties of the bacteria, and these 2 medicines might inhibit the process. Third option we have are the stool tests. There are 2 types of stool tests that a physician can order: a stool antigen test, which look for antigens to H. pylori in your stool, and a stool culture test, which looks for H. pylori bacteria in your stool. This has pretty much the same advantages as the urea breath test. It offers evidence of active infection. It can be used as a first diagnostic test as well as the response to treatment test, and the physician also needs to stop the antibiotics and PPI for at least 2 weeks prior to ordering the test. Another disadvantage this test has is the discomfort during sample collection of the patient and the physician. So all of the tests mentioned above were non-invasive testings, and if your physician cannot come to a definitive diagnosis, then he or she might order an endoscopy. The endoscopy will allow your physician to examine your esophagus, stomach lining, and a segment of your small intestine. Since this is an invasive procedure, let me explain how this is going to work. You'll be asked to lie down. You'll be given a medicine to relax and prevent you from feeling pain during the procedure. Your provider will then insert a thin tube called an endoscope into your mouth, and the endoscope has a light and a camera on it, so the physician will get a good look of the internal organs. The provider may take a biopsy, which is basically removing a small sample of the tissue that we can send it to the lab for testing. After the procedure is completed, you'll be asked to stay at the facility for about 1 or 2 hours, and you may be drowsy for a while, so have something back home. But just to get a little technical here, endoscopy is considered as a gold standard in detection of H. pylori, but it is important to highlight that when I say endoscopy, the actual test we're referring to is biopsy performed, so it is typically considered histology, which is the gold standard. The accuracy of this test might be affected by the size, the number of biopsies, the staining method, the proton pump inhibitors, or antibiotics that are consumed by the patient. But all in all, paired with an endoscopy where the physician gets a good look at your stomach and the biopsy results from the lab, is the best way to detect H. pylori infection. It's also important to mention that staining is a critical part of histological exam, and what staining your physician uses can have an impact on the accuracy of results. There are many things available in the US, but the most popular one is the stain. It's pretty simple and it provides a very good contrast of 134 to 259.